Hello, hello, everyone. Hi, how are you all doing? Thank you so much for tuning in and for joining. So, I'm ready to answer any questions that you may have. So, if you type the question in the comment section, I will try as much as I can and give you the answers. So, I'm waiting for everyone to join in. Please type in any questions that you have. Is it safe to work in a care home as a senior carer? Obviously, yes, it is absolutely safe to work in a care home as a senior carer. There's absolutely nothing wrong with that because obviously, I don't know what will make it not a safe place to work. It's nothing like somebody coming in, to do anything that is not really accepted. So obviously, yes, it's safe to work in a care home. And Mimi is also asking, do I need to do IELTS? If I would like to apply for the Tier 5 visa. So for the 5 visa, you don't really need the IELTS to apply for the charity worker visa. But if it gets to the point where you are applying for the visa, once you get the offer, then you will need the IELTS just for the visa application purposes. Diana Mawisi. Hello, Diana. I'm registered diploma nurse trying to relocate as a healthcare assistant because of the almighty IELTS. Oh my God, this IELTS is actually becoming a problem to people. Do I have to have a care certificate? If you have a care certificate, it will actually your chance of getting a job. The care certificate over here is more like a certificate that allows people to work as healthcare assistants there. But if you apply from overseas and you don't have that care certificate yet, what you can do is you can go online and do that care certificate course. It contains 15 modules and it will tell you a lot about how the UK system is. You actually learn a lot about infection control, safeguard for you to start work. So coming here without having any knowledge about their system and how it works can be very, very difficult. So if you have the care certificate, it will be an advantage. If you don't have the care certificate, you can put in every clinical care experience that you have in your CV just to also boost your chance of getting a job. Also, you can put every experience that you have in your cover letter as well. But if you have the care certificate, it will be an advantage. And I've done a video on how you can apply or how you can get a care certificate. It's on the channel, so you can have a look at it. Another one, Peter said, I have applied to one care home company, and I was told that they no longer. I don't really get the question. I applied to one care home company, and I was told that they no longer. I don't know if he's trying to say they no longer issue certificate of sponsorship. They also said they've applied for more. They've applied for more certificates, and that they will get in touch with me when that changes. Well, there are so many care companies in the UK that did not have the license to give sponsorship. So they have the job offer over here, but then they don't have sponsorship for overseas applicants. So for a company like this, if you apply to them, they may not actually be helpful. For those companies, you are better off applying to them if you're already here in the UK. So if they are not issuing certificate of sponsorship at the moment, then if you apply from overseas, it will not be helpful. So look out for the ones that are giving tier 2 sponsorship to people from overseas. So that at least you know that once you get the job offer, you can apply for the visa. So Peter, I hope I've answered your question. So I'm waiting for more questions from anybody. I'm hoping to end this session by 6 o'clock since I've got another appointment. So hopefully we would be able to answer some questions. And also, I think one good thing is it's live. It's just going to be on the channel. So even if you don't get the chance to stay through till the end, you can always come back and watch it. So, care assistant or senior carer. So in the UK, you have healthcare assistants, senior carers, home uh, home care workers, domiciliary workers. They all do different things, but then their roles are a bit similar. So if you are in a hospital and you're working as a healthcare assistant, what you might be doing is you might be assisting the nurses in their job. You can do certain things like doing cannulation. You can also be taking blood samples. They give you extra training for that. They can also You can also do ECG. You know, when you have a cardiac problem, they put those leads on your chest just to monitor your heart. Healthcare assistants in the NHS are trained to do that as well. They also help in feeding patients, helping them mobilize, helping with personal care like bathing and all of that. So they do a lot. Also in the care home, carers or senior carers might be doing something similar. But if you're a senior carer, so it's like you're more like in a higher rank compared to somebody who is just a carer. So as a senior carer in a nursing home, you might even help the nurses in administering oral medication, which is very, very good. So you can also be like a supervisor for the other carers. If you are working as a domiciliary worker, what you might do is you'll be going to other people's homes to look after them. So they are not in the nursing home or not based at one place. So they go from house to house. So if you get any job offer, which is a domiciliary work, what you would need to do is to get a driving license. At least when you come, you will be able to drive. So if you wish to come as a domiciliary worker, I mean, not even as a domiciliary worker, if you wish to come to the UK, try and get an international driving license from your country before you come in here. Even if you are driving and you have your own driving license in your country, before you come here, try and get international driving license that will allow you to drive in the UK for 1 year when you arrive, so that later on you can switch to the UK driving license. Let me get more questions. The questions are really coming, so let me start reading them and then I'll try and answer. So the last one was Peter's question, which I believe I've answered. And Abna Ajima is also saying, hello, Diana, can one apply for different positions in the same company? You know, there are so many vacancies being advertised by one company. So if I have chances for all those places, so you don't need to limit yourself to just one job offer. So that company might be offering get it. You might get the job that they are advertising in another city. So you can send in as many applications as possible. That's what I think, so that it will increase your chance. But if you stick to one, it will actually limit your chances, because you know that this healthcare assistant jobs has become so competitive. So I would say that don't limit yourself to just one company or just one job offer or just one job vacancy. Or the more you throw in the application, even if you can apply to like 20 in a day, please do, so that it will increase your chances of getting the job. So I hope, Admana, you're okay with this answer. There is another question from Abigail Kwanzaa. She says, I am a registered public health nurse. Can I relocate without being a carer? So if you want to migrate to the UK as a public health nurse, then you will need to come in here as a registered nurse first. Then you will find public health jobs. That's so easy. Because I also had a public health degree, but then I'm working as a registered nurse here. And if I want to switch to public health, it's so easy. You just have to go online and start searching for public health nurse jobs here in UK. So yes, so the second part is, can you relocate without being a carer? Without being a carer, I hope that's what. If you don't want to relocate as a carer, then it means obviously you want to relocate as a registered nurse. So obviously you have to go through the IELTS, the CBT, and then you can come in and work as a registered nurse first. And then if you wish to go into your area, which is the public health, you can always branch and do that. Let me get another question. Becca Bay TV. Hi, fine mama. I am doing so well. Thank you so much for joining, Becca. And I will be very, very happy if you could also help me as well. If you don't know Becca, she is also a YouTuber, and her channel name is Becca Bay TV. I've done a couple of videos with her. The recent video, actually, I posted a video today about comparing nursing home and NHS, the pros and cons, advantages and disadvantages of working in these two facilities. So if you've not watched that one, kindly have a look at that, and also subscribe to her channel as well. She is hiding in the corner and answering some of the questions. And another question. Oh, so in which way is it better to come to the UK as a senior carer, healthcare assistant, or registered nurse? If you are a registered nurse and you can manage to do your IELTS, your CBT, and all of that, come to the UK as a registered nurse. People are going through that senior carer or healthcare standard because maybe they've tried the IELTS several times and they are not getting the required NMC score. So if you manage to get your score that the NMC UK requires, why not? You can definitely come as a UK. So you can definitely come as a nurse. But if you are struggling with the IELTS and you feel like taking that route will be another good option, you can do that. And then once you get here, you can still try. Apart from the IELTS, they have OET. Unfortunately, I think OET is not so common. You hardly hear about it. People don't even have study materials and all of that. So it makes it a bit difficult for people to actually get it. So if you can come here as a senior carer and then hopefully try your best. I don't want a registered nurse who actually, I mean, still love and have passion for working as a nurse to come here to work as a healthcare assistant and then just get started. I'll be very, very happy that even if it's the IELTS has become a challenge, a barrier for you. Once you get here, please do not relax. Try and then get your out. Even if it's OET, you need to try and then do it so that you can register, get your pin, and work as a registered nurse so that you can really feel fulfilled. Because it can be very, very frustrating, when you actually feel like, I mean, you are a boss back home, you are a nurse, you are in charge, and then you come here and work as a healthcare assistant, and you don't even force or try to really get to that level that you wanted to get to. So you can come here through any means, but if it's a registered nurse that you really want to be, then try and get the score that NMC requires so that you can work as a nurse. Let me take another question. Himanfi, he said, can I know about the domiciliary care in London? So domiciliary care in London will be the same domiciliary care anywhere within the UK. So what domiciliary care workers do is they are not based in a hospital, they are not based in a care home. They go to the clients or the patient's homes because most of the patients they prefer to live in the comfort of their own home so that they will have carers coming in to look after them. They don't want to be in a nursing home. So the domiciliary workers, they move from house to house to look after them. So you can go maybe in the morning to a patient house, you help them quickly to get out of bed. Some of them might be bed bound, so you need to help them with their personal care, like changing their linen, changing their diapers if they are wearing one, and then you just help them with basically the personal care. You get them breakfast, and then once you're done, you move on to another patient's house. So for that one, you need to be a driver. At least you need to be able to drive so that it will make it easier for you to move from house to house. Let's get another question. Um, okay. So I hope I've answered your question about the domiciliary worker. And let's take the next question. Hello, Dine. I wanted to find out how long does the certificate of sponsorship take to proceed? That question is quite difficult to answer because each hospital have their own way of going about that. But then what I know is once you get a job offer, it should not take long. If you give them all the documents that you need, the agency or the care home will apply to the home office to get the COS for you. So if you send them all the documents needed, it shouldn't take long at all. At all, honestly. I When I was moving from one hospital to the other, I did my interview in August, and then I had my certificate of sponsorship the following month. So it doesn't take long. When they apply to the home office, it doesn't take long for them to issue. But what delays is if there are a backlog of applications, that is what might affect it. But then if you've gotten a job, just pray hard that the COS is issued for you. So the most important thing is to get the job offer, honestly. The COS definitely, if you submit the right documents, there's no way you will miss it, honestly. So I hope you are okay with that. Peter is asking another question. He said, for my first question, when I applied, they called back to tell me that they offer COS to overseas applicants. And I was asked about driving license, and I told them I applied for it and it will be ready soon before the first message. So this is where your question ends. I don't know if you're going to continue further, but from what I gather, you say from the first question, when I applied, they actually told me they offer COS. Okay, so if they've told you that they offer COS, then it means you have nothing to worry about. It means that definitely once you get the job offer, they can issue you that COS, which is one of the important documents you need to be able to apply for your visa. So if they are offering the COS, then just keep your fingers crossed that all the necessary procedures will also go through for you to get your COS, and then you can come here. And another document that you need after you've been issued the COS, definitely I will encourage everybody coming in the UK to work to get the international driving license, because I really do regret not doing that. Either was I would have been driving long time. I've been here for a while, but I still don't drive. And sometimes it can be very, very challenging if you need to go somewhere really, really quickly. It's more convenient. Also, if you manage to like register with an agency where you are getting a lot of shifts, some overtime. Sometimes if you drive, it's really an advantage. So try and work on the driving license before you get here. And apart from the driving license, you need a tuberculosis test. So you need to bear in mind that as well. And get your CV, your cover letter, get everything sorted. A lot of people have sent me their CVs to go through for them, but honestly, it's a lot of work. It's tedious, and I've got like quite a tight schedule, so I will not be able to go through individual CVs. So what I can do is I'll do a separate video on like a properly structured CV for a nursing job or either for a healthcare assistant job, and I'll post it on the channel so that you can use it as a guide. If you definitely go through this, there's no way you'll miss it. So just look out for that video very soon. And another question from Manini. She says, what decision is going to come after 8 weeks of review of midwifery council about the IELTS and OET? We are still waiting for them to get back with the outcome of their interview, of their decision. They said that they are going to sit down and consider 3 areas regarding the IELTS, whether to decrease the score of the OET or IELTS, whether to accept employment reference, or whether to consider those who have had postgraduate study, which was examined and taught in English. So they had their meeting on the 26th of May. We've not really had any feedback yet. So I'll go on their website and see if there's any update on that. And what they said initially was if they finally agree on whatever they decided, they will implement it in October this year. So let's hope that they will reduce the IELTS, the OET, or consider employment reference, or the other one, which is um, the postgraduate, which was taught and examined in English. So if you've got if you happen to fall within any of these areas, then I believe that it will be a very, very good advantage for you to come. Because I know most people have done the IELTS. Some people have had 7 in all the modules, and then they get 6 in writing, or 6.5 in, or 6.5 in reading. So you are still stuck, but it's not easy getting 7 across board. So I hope that once they actually take a critical look at this and consider whatever they were proposing, I believe by October we'll hear something positive, and I hope that they will actually implement it. So please keep your questions coming before it ends. I've really enjoyed this session, and I hope that it will be of benefit to everybody who stays to actually watch this. And if you are not even able to stay through to the end, once it's live, it's going to be on the channel, so you can always go back to it and watch later. So Victoria, I've seen you. Um, Himanthi, I've seen you. I cannot mention some of the names, but whoever has joined, I'm so grateful. Mukesh Kuma, I've seen you. Maneni, you're the first person to join. Thank you so much. Rafuru, then Karin Tete, Victoria Sim, Israel, Ebenezer, Focus Steady Abroad. Ow, Focus Steady. I'll be very happy if you could get in touch with me later. And Mimi, Dynamausi, I really appreciate all of you for your support. So if there are any more questions, please keep them coming. I'm here for you today. So I'm here to answer any questions that you may have. Though I also did another video on the charity worker visa. Anytime I come across anything online, I just share it with people. David Daddy from Uganda, thank you so much for tuning in and for joining. So I was just about to comment on the charity worker visa video I did. So there is this agency or care company called Latch or Lache. I don't know if I'm pronouncing it right, but if you check on my channel, there is a video on how to apply for Tier 5 charity worker visa. So it's a very good way of UK like opening their doors to other people, a way of you entering into the system. And some people were asking, since it's a charity work and supposedly a volunteering work, how do you support yourself financially whilst you're here? On their website, on the website of that company, they've stated that they will be giving you allowances, and this allowance can also like be very, very supportive. They also give support with accommodation, and also you can bring in your dependent. If you're married, you can bring your spouse, and your spouse is allowed to study and work. You, the applicant who is here on the charity worker visa, you can also work part-time, you know. So it's not really like you just coming here and not knowing how to even support yourself financially. So there is a lot you can gain if you come through this route. Manine is saying, thank you, dear sister, for your wonderful answers. Thanking and thanking time for us, or maybe taking time for us. Thank you so much for joining. If it was not you, I will not be live. So I'm here for you, and I'm happy to take as many questions as possible. If there's any question that I don't know the answer to, I'll definitely take down your name and I'll research into that and give you feedback at the appropriate time. So please keep your questions coming. Ask a question. So please, this is opportunity for you to ask any question. I'm here for all of you guys. And if you've not joined the Telegram group yet, please join, because a lot of people are benefiting from the information we are putting over there. So please join the Telegram group. If you check on my channel, there is a link to the Telegram group. So I did a short video just to like let people know that I'm creating that channel. So stay I did a short video on the fact I was creating that Telegram group. So if you check on that video, the link will be there. So you can just click and join. And feel free to share if you come across any information that I have not even heard of. Please post it on the platform so that other people will also get to know of it. Someone has just sent me a WhatsApp message. Focus Study Abroad. Thank you so much, Focus. I've seen your WhatsApp. I'm going to get back to you as soon as I'm done with this live video. Thank you so much. Right. Someone else, Dinah Mausi, is asking, hello, Dinah. Network is really worrying me here, and I couldn't get the answer to my question. Please, should I have to go back and check the question that you asked? If you can just type it in again as well, it will be very easy for me instead of going back. Okay, I think I've seen your question. You said, hello, Dinah, I'm registered nurse trying to relocate as a health care assistant because the almighty IELTS. Please, do I have to have a care certificate? So the answer I gave to this question was having the care certificate actually helps boost your chances of getting the job. The care certificate is something that you need in order to work as a healthcare assistant here in the UK. But you don't really need a degree, you don't need a master's degree or any higher qualification to work as a healthcare assistant. So the care certificate is more like something to show that at least you have some basic clinical skills to work as a nursing assistant. So here I've been a supervisor to most of the healthcare assistant, and there is this booklet that you have to sign for them as and when they perform certain procedures. So you observe them to make sure at least they are competent in doing certain things. And then once you sign that booklet for them, they would also give it to the clinical educators, and then they issue them with the care certificate because at least they've been signed off as competent for these. So if you're applying from overseas, what you can do is if you go on my channel, I've done a video on how you can get the care certificate online. You can do the course and get that care certificate from overseas. So if you check that video, you will have listed like a few links that you can click on and study and get that care certificate. If you add the care certificate to your well-structured CV and a cover letter, it will actually boost your chances because during the interview, they might ask you a lot of questions that if you've done the care certificate will help you to even answer. So in the care certificate course, you learn something like infection control, nutrition, and hygiene, safeguarding. So you get to know the basics of uh, like what to actually do as far as the UK setting is concerned. So if you don't, since you don't know, we don't really know anything at all about how the UK system will, it will be very, very good if you do the care certificate so that at least it will help you enlighten you on some of the things that you might even come across during your interview. So if you have the basic clinical skills and you add the care certificate on top of your documents, it will actually give you an upper hand. So if it's fine, if you cannot do it or if you don't want to do the care certificate, then you need to make sure that your CV is well updated with every clinical skill that is needed to give you the opportunity to get the job. So I hope Diana answered your question. And Georgina Ade is also asking, please, I want to ask of the large UK, the actual age they needed for their job offer. On the website, honestly, they did not state any age limit. So if there's anything that I've not seen, I will actually go back and check. But then, as far as I know, I did not see anything about age limit. And then Himanthi said, thank you so much for your clarification. Thank you so much, Himanthi. If you've not joined the Telegram group, please join. And we are sharing information on there every single day. And the reason why I created that Telegram group was anytime I come across a job offer, I'm always in a rush and I don't always get the chance to do a video about to share it with people. So the moment I find anything very useful, I just click on the link and then post it on the Telegram group so that people will get to know of it. I don't always get the chance to do a video about the information I come across. So that Telegram group is a very, very good way of getting information to a lot of people like within the shortest possible time. So if you've not joined, you can also join. And Georgian, I hope I've answered your question about the large UK. I'm going to accept a few more questions and then we will call it Day. So wherever you're watching me from, thank you so much. Thank you so much for joining. And it's been a wonderful session, honestly. I'm always excited to share information. So I'm always happy when people ask me questions. So please do keep the questions coming. I've got another appointment at 6 o'clock, so I might end maybe 10 minutes to 6 so that at least I can quickly rush for the appointment I've got at 6 o'clock. So I'm still waiting for a few more questions. I'm so happy to be here to answer your questions. So please keep them coming. David, David is asking, what's the cheapest way to migrate to the UK? Because I'm really interested. David, there is no cheapest or easy way. But then I think all in all, you coming to the UK as a nurse, I don't know your background, David, but if you're a registered nurse, it shouldn't cost you anything to actually come in. You're not supposed to pay money to any agency to get you a job here in UK as a registered nurse. You can do everything all by yourself. What you will need to pay for is obviously your IELTS. You have to pay for your, that is if you're a registered nurse. So you need to write the IELTS exams. You need to pay for your CBT, that's the English, the nursing test. And then you need to do a tuberculosis test. If you don't have a driving license, you would also need the international driving license, which will actually be of benefit to you when you get here. That one has nothing to do with you registering with the UK. So it's just something I'm seeing in passing. And so when it comes to you getting the job, you can also sit down behind a computer if you've got internet access. Just go online, search for jobs. You can look for jobs on website like Glassdoor, Glassdoor, and then Indeed.com, Indeed.com, TotalJobs.com. So the NHS jobs. You can also search on TrackJobs.com. So once you get access to all of these websites, search the type of job you're looking for. If it's a registered if it's a registered nurse job you're looking for, just type it in and then search. If it's a healthcare assistant job, just start searching. The moment you see any, just have your CV, your cover letter, and everything, all your documents well structured. The moment they ask you for any documents, you just upload and keep applying to as many as possible. If you manage to get a job offer, the certificate of sponsorship will be of no cost to you at all. If you're lucky, some of the agencies or care companies might even pay for your plane ticket, your visa, and everything to come in. Me, it did not cost me anything at all to come in here. Even my CBT and the IELTS, the hospital paid it back to me. So obviously, it cost me nothing. So it should actually not cost you anything at all, ideally. But some people do not really want to do the work for them, CV for you. Maybe the person might, to have that time, to sacrifice the time to go through that for you. Somebody might ask you to pay something small, just to help you with your CV and all of that. But ideally, to get a job to relocate to UK, it shouldn't cost you anything. Your plane ticket, if you're lucky, your agency paid for you. Fantastic. So honestly, it all depends on which agency you're going in for. So ideally, nobody should charge you anything to get you a job or to bring you to the UK. You can do everything all by yourself. And I hope you're okay with this answer. Ted in the NHS. I know why you're asking this question, Becca. Fine. So if you wanted to get to the UK as a registered nurse, promotion here in the UK, it doesn't come automatically. It comes um, by you applying for the position. So they don't just promote you after every 2, 3 years, just like some of us are used to back home. But here, you need to apply for it. So if you wish, for a registered nurse, you start off here in UK as a band 5, and then you go to band 6, band 7, band 8, up to 9, the deputy chief nurse, and all of that. So if you want to move from one band, maybe band 5 to a band 6, what you really need to do, what I did was, I tried to do like overtime shifts in so many other wards. I didn't limit myself to doing overtime work in my own ward alone. So if you do shift or if you do overtime jobs in other hospitals or in other wards within your hospital, it enlightens you on actually what goes on in other facilities. You learn a lot. But if you are limited to your own facility, you not learn of what's going on in other places. So the more you go out there, put yourself out there, the more you learn. And you should also relate very well with your colleagues, with your manager, because sometimes when the job is advertised, you definitely will be the manager who will definitely interview you. So if they get to know how hardworking you are, how polite you are, you've got you are well managed, you talk to patients and staff, you relate with them in a very good way. I mean, it all counts, and you are really, really likely to get yourself up there. But if you are always hiding, you don't participate in anything, I mean, it goes against you, honestly. And also, one thing I would say that if you realize that the environment you find yourself in is not an environment that will actually get you promoted, do not stay there. Just get a few years or months of experience and then move. Because I realized that in the hospital I was working initially, I realized that it was going to take me a long time to even get to advances. So I left that hospital immediately. I found myself in a new place. That was how come I got promoted. So you don't get stuck at one place at all. And Becca, I hope this answers your question. I hope to see you soon because we need to do another video. Diana Mawisi is asking another question. Please, I asked if a diploma nurse migrating as a carer or healthcare assistant needs care certificates. I think I answered the question. I've answered it twice. This is the third time. What I'm saying is, you may be a registered nurse, a diploma, or a degree nurse, but you are not coming here to work as a nurse. You are coming here as a healthcare assistant or as a carer. So you portraying yourself as a nurse will not actually, it's not what they need. If you have your nursing degree and you are not coming here to work as a nurse, try and then draw on the experience you have as a nurse to apply for the job, but do not put yourself or portray yourself as a registered nurse because you are not applying for a nursing job. So regarding the care certificate, you will need it. It will be an advantage to you. It's not compulsory, but if you have it, it will be very, very good because having that care certificate, like I'm saying, if you go through that care certificate course and if you go through the models that you learn, it will actually be of benefit to you. It will surprise you what you can learn. If you learn those 15 models in the care certificate, it will really help you in your interview. There are questions that will definitely come from the knowledge that you've acquired, and the answers you might give will be the knowledge you've acquired from doing the care certificate. So it's not a must that you should have it, but if you have it, it's going to be very, very, because you learn a lot in that case. It will open your mind on a lot on what to actually expect when you come here or what actually goes on here. So it will be an added advantage for you if you have it. Yeah. I hope this answers your question. So I'm going to end the session within the next 8 minutes. So if you've got any other question, I'm happy to answer before we end the session. And I hope if you want to come back to this video for to refresh your mind on some of the answers I've given, you can always come back because it's going to be on the YouTube. So I will, if you've got any questions on like care home or working in the UK as a care home nurse, I'm happy to answer some of the questions as well. Thank you so much, Becca, and I hope to see you soon too. If you have any question regarding working as a nursing home nurse, watch the video I did with Becca on comparing healthcare, comparing nursing in NHS and care home, the pros and cons. I posted that video today. I did it with Becca. She is a registered nurse from Africa, also working in the UK. She was working with the NHS, but she's moved to the care home, and we did a video together. So we were comparing how it is like working in NHS compared to the care home. So it was a good video. Who have given us a positive feedback because we did touch on a whole lot, and I hope that it will be beneficial. Thank you so much, Diana Mawusi. I hope this clarifies your question. If you have it, it will be an advantage. So if there's any more question, I'm happy to answer. If there isn't any more question, the session is going to end in the next 4 minutes. So I'm still waiting for any questions that you may have. I've really enjoyed this session, and I hope that my answers is going to be of benefit to you and is going to be helpful. So I'm still waiting for more questions. Someone also asked me this question that if you get the care if you get the care worker job and you manage to get your job offer and your COS, do you come here with your relatives, your family, or you have to come here and later bring them? So it all boils down to you. Normally, you, the applicant, you are the one that the company is targeting. So if you they manage to get you the job offer, the certificate of sponsorship, if you have the finances, you can apply for your dependents to come along with you. But if you don't have it, you can come here, survey the system, the environment, see if you like it, and then see whether it's going to be of benefit. Then you can actually, but hopefully by the time you get here and spend like 6 months, you know your way around the system, and you can actually, you would have even worked enough to get money to actually bring your family over. So that would be very, very helpful. But if you can afford it, you can do the application together with your spouse and your parents and come along with them. If you're a registered nurse, what I would advise is do not come with your family because you are coming here to do your OSCE. It takes a while for you to even go through all the training to get the OSCE, to get your PIN. The training for the OSCE can be very, very intensive. So come here on your own, try and then put in every effort, concentrate, do your OSCE, pass, get your PIN, then you can come here as then you can actually invite your family over. By the time they come, you'd have been more relaxed. You would have studied the system a little bit. It will be easier for you to show them around, and then you guys will settle in perfectly well than bringing them over, accommodation, family, plus thinking of having to learn and pass your OSCE is going to be very, very, it's going to be quite challenging. It's going to distract you more. So that's just a personal advice. Yeah. And also, people are contemplating on whether to come to the UK to work as nurses in NHS or to come nursing home nurses. So in the video that I did with Becca, one advice that she gave was if you are coming from overseas, it's best um if it's not compulsory though, it was just a personal advice because now getting the job has become very difficult. So she said because she had experience in the NHS, it was easy for her to move around to do overtime in other hospitals, and it made it easier for her to manage the nursing home on her own, even if she happens to be the only nurse on duty. So this is just something I'm seeing in passing. So I'm going to end this session now. I hope it's been very, very useful. I hope it's been beneficial. I hope it's been insightful. So if you've enjoyed it, thank you so much. And head on to Telegram group and join. If you check the video I did about the fact that we were going on Telegram, you'll see the link to that. So kindly join and then just post all the questions that you've got and share any information that you also have. So David is asking, is it possible to join you on this live? If it was possible, I would be very, very happy, but I don't know how it's done. I believe there will be a way out, but you can, let's chat on my Telegram number and then we'll find a way out. It should be possible, I believe. The other day we had a nice session on Zoom, but then with Zoom it only allows you to talk for like 40 minutes or 30 minutes. So the thing just went off because there's a free version and a paid version. I think the version I was using was the free or the basic plan. So it only allows you to have a discussion for only 30 minutes. So that was how come I felt like coming live on the YouTube. So it was quite beneficial as well. So if there are on live, I think it should be possible. I don't really know it. I'll see and then I'll let you know. So thank you so much guys for joining me, and I hope you've enjoyed this session. So I will see you around. I'll see you another time. Keep the questions coming. I believe even after I've signed off, I'll definitely come back to it and answer all your questions. Thank you so much for joining and hope to see you again shortly. Bye bye.